Welcome to the Everything Cancer podcast. This podcast is intended for survivors, those who love them, healthcare providers, and cancer support organizations. Our guests offer insight into the honest survivor experience, how challenges are met head-on, and where blessings are discovered. We cover effective self-advocacy on the bumpy road of cancer survivorship from the moment of diagnosis on. We talk about rekindling intimacy when cancer has changed your world. We are given behind the scenes insight into cancer care because understanding it better empowers you to advocate for yourself more effectively. We hear from leaders of cancer support organizations about their resources and how to access them or those like them. The Everything Cancer podcast welcomes survivors who would like to share their journey and how they have met their challenges, providers who would like to share their empowering insight, and leaders of cancer support organizations who would like to share their stories and resources. We welcome support through sponsors, the Everything Cancer website, and our Patreon page. Please note the information shared on the Everything Cancer podcast is not intended as medical advice. Please always consult with your healthcare team. The staff at Everything Cancer podcast will not answer individual healthcare concern questions. Thank you for joining us, and we hope that you enjoy this episode and find it useful. Please do share it with other people if you think they'll benefit from it, and rate us on your favorite podcast platform. Thanks and take care. Welcome to the Everything Cancer podcast, where guests offer insight into the honest survivor experience, how challenges are met head-on, where blessings are discovered, and helpful information is shared. We are so glad to have you here, and we hope you enjoy today's episode. As you know, the information shared on the Everything Cancer podcast is not intended as medical advice. Always consult with your healthcare team. We would love to hear from you, your suggestions for topics or guests, and your comments about the show at everythingcancerpodcast@gmail.com. Remember to rate us on your favorite podcast platform and tell others about our show. Now on to the episode. Hello, everybody, and welcome to the Everything Cancer podcast. We have double trouble here today with Dr. Sam Siegel and Sam Siegel. Dr. Sam Siegel on the left of your screen is a pediatrician, and Dr. Sam Siegel with the pink headband is an onco-generalist, and she is running a survivorship clinic with Kaiser Permanente, and they are both also survivors. So they bring both experiences of being a provider and a survivor to the table. They both have supported each other through their diagnosis, very tough treatments, and survivorship. And they have a busy family of children, and they have that experience as well of dealing with a family they both work, and they both have been on the survivorship continuum with dealing with their 3 girls. So they have a lot to talk about with all of you in our audience that you can relate to. And they talk extensively in public speaking about self-advocacy because they have a lot of lessons learned through their experiences that I think a lot of you will be able to relate to, and our providers who listen as well. So Sam and Sam, thank you for being here.
Thanks for having us.
Yes, thank you.
I have to correct you though, because I feel like if our kids listen to this podcast, they'll be bummed if we didn't. We have 2 boys and a girl.
Oh, I'm so sorry. Okay,
No, it's
2
okay.
boys and a girl. Well, there, now it's corrected. So what are their names? If you don't mind sharing their first names, and if you don't want to, I get that.
No, that's fine.
We have Murray as our oldest, and then Gilad is our middle, and he goes by Goose, actually. I think there are many people who don't know his real name. It's been his baseball name forever. And then Lily is our youngest. And
okay.
Our house is very quiet right now because they're actually at Camp Kesem.
Wow.
Which is, for people who don't know, it's an amazing 5-day sleepaway camp for kids whose kind of parents or caregivers have been impacted by cancer. So this is our 3rd year that our boys are going, and it's our first year for Lily to go, and she's so little. She's just 6.
She turned 6, but she's going with her big brothers, and she's a pretty strong kid. I think she'll have a good time.
Yeah.
Oh, she's got to be strong with having 2 older brothers.
Oh,
Yeah.
exactly. But
Yeah.
the Camp Kesem is really great for people out there. It's totally free for any kids that basically had really a close person in their life that's had cancer. It's a wonderful camp. I think it has chapters all over the country, right? And
Yeah, it's run by college volunteers, college students volunteering.
yeah, and our
Wow.
2 boys, they've been there. This is going to be the 3rd year, and the two previous summers, they just had wonderful experiences. They can't wait to go back the next summer.
That says something when they tell you they can't wait to go back.
Yeah.
And I'm sure for them, it takes a mantle of weight off their shoulders when they can be around other kids and just talk about their experiences and how they feel. Right.
Yeah, and I think I hope that what we're modeling for them is that there's community in this, even though it could be very hard and sad sometimes, and we wouldn't have wished this experience on them for anything, that there's also a lot of beauty and resilience and community in this experience. And I think they see that and they feel that now. In fact, my daughter, we were in the car the other day, and my daughter heard I was listening to a lecture for my integrative medicine fellowship, and they said the word cancer, and she went, "Cancer!" like she cheered, because in our house, it's something that we've both dealt with and do a lot of advocacy, and I get all fired up about cancer. And so that was really interesting, even to just hear her response to the word cancer. It wasn't like, "Oh, cancer, that's really sad and scary." It was like, "Cancer, yeah."
That is an interesting
Right?
response. But she sees the way you are carrying forth advocacy in cancer. So she sees the cheer part of it, of you're uplifting others. And
I think.
She
yeah,
has. And we I mean, I guess fortunately or unfortunately had the experience of, because of my illness, having to learn kind of the hard way how to properly bring along a child through the cancer or the chronic illness experience. And we didn't do it as well as we could have for particularly our oldest son, who's now 12. And so by the time Samantha got sick, which was unbelievable, we had already had that experience. We'd already made mistakes. We had already learned kind of how to do it better. And then by the time when Samantha first got sick, she was what? She was 3. She was 3. So we were just much better equipped at that point, because it is tough. There are definitely, like, there are books about how to get through cancer yourself. There are, you get a lot of advice about how to, keep your wellness and so on and so forth. But there's no literature out there for how to shepherd your child through cancer. There's a lot in the pediatric world, there is a ton of child life specialists. There's a ton of experts for how to shepherd a child through cancer, but how to shepherd a child of one of parents that has cancer. That's something that really, I think, is an area that we could definitely all improve on. And that hopefully that's one of the things that we try to speak on a lot, because there's not a lot out there.
Yeah, I think there's more and more, and we were talking about some amazing advocates earlier who have kids, like Amanda Ferraro, and her son has written a book, and so there's yeah, I think there's more and more people that are coming forward about this experience. But yeah, when it came to our older kids, I mean, we botched that pretty hard. Like we thought we were protecting them. In fact, we tell this story sometimes about our oldest son who who actually, one time when Sam was in the hospital leading up to his liver transplant, he was very sick in the hospital, and we thought we were protecting the kids by saying, like, "Daddy's away on a trip." We just said that he's away, and they were pretty young. They were about 3 and 4, or maybe 4 and 5. And then we just kind of left it at that. But I'm sure that he heard, like, my quiet sobbing at night, or the hushed conversations, or other family members like, "Is everything okay?" I'm sure he felt it, and we didn't address it because what had been modeled for us in our earlier lives was just that the parents would take care of it, or the caregivers would take care of it, and um, and the kids could just be kids. And so we thought we were doing right by them by doing that. And
particular was, I think it was probably me, because I think she deferred to how I wanted to deal with the kids because it was my illness at that point. And my model was my father. When I was, I think, about 9 or 10 years old, my mother had breast cancer. And this was back in, 1989 or something like that. And the breast cancer treatment at that point was 1989. She had aggressive treatment, and we have all the BRCA stuff, and so she had mastectomy. She had really heavy chemo, really heavy radiation, and my dad's approach at that point, which I can't fault him on, he was just like, let's try to just get through this with the kids being exposed a little bit to mom's illness, which I think is how a lot of people feel about it. And also is he was also very confident. He's a doctor. He's a very smart guy. He's very like, when it was like a crisis, he's the guy you want in there. And so there was like a blind trust I remember I had as a 9 or 10 year old that my dad would just take care of it. I didn't have to know any details. So I thought that maybe that was the right approach for our own kids, and it wasn't. And anyway, that's that's my background. So this was breast cancer in 1989, and then fast forward to the 2010s. And then I got sick, and then you can go ahead and continue with Murray with how.
Yeah, so we thought we were. Do you want to get the dog? No. Okay. So yeah, we thought we were protecting Murray, and so we didn't mention anything. And then about 5 or 6 months later, after one of these big hospitalizations, Murray started losing his hair, and like a lot. I mean, it was like coming out in clumps, and we took him to the doctor, and we were terrified that something was wrong medically. I mean, I say that if I was like waiting for the next medical lightning bolt to strike, and so we did all this blood work and all this testing, and it turned out that there wasn't anything medical that she could find. And then our pediatrician said, is there any like major stressors going on in your house? And we said, well, yeah, he's leading up to transplant. And we told her everything that was going on, that he had been, on the ventilator, and a GI bleed, and that there was really serious things happening. And she said, oh my gosh, that's it right there. And that it fit about the time frame of this really stressful event. And then however many months later, that's what was happening. He was having a stress reaction. And then she said, there's no way to protect your kids from this. You have to talk to them. And she connected us with child life specialists, who then taught us how to talk to them. And they had special little kind of toys to teach the kids about IV tubing, and taught us about having conversations with kids. Like, you let them guide the conversation, like you give them a little piece of information, and then they might ask follow-up questions, or they might not, and they might run away and play, because that's as much as they can take at that point. And so then we sort of learned the art of shepherding a family through serious illness, and we got better at it, so that when the time came when I got sick, it was still extremely hard, and there were bumps along the way, but we were much better at it than through his illness. And I think our kids had a really honest understanding, and it was still a little bit isolating, like compared to their friends and other houses with kids our age. Like, death is a word in our house. We talk about death, and we talk about just mortality. We talk about just a lot of conversations that maybe families haven't had to deal with till their kids are a little bit older. But especially once I got sick, and then when I went in for my bone marrow transplant, I think we just felt that it was really important to be as honest as possible with the kids. And so, yeah.
And basically we learned that, you have to say something, and you have to, and it's hard to, I had a little bit extra as a pediatrician, a little bit extra insight into developmentally the different stages that they were at when we were talking with them. So you try to basically, I would say, you meet a kid where they're at developmentally, and you basically, you have to expose that something's going on. You have to bring it up to the open. And then once you do that, like Samantha said, you basically introduce the subject, and then you kind of, and then things will happen. Like, you may think that they don't have any idea what's going on, Can you get the dog?
Yes.
You may think that, that they're not kind of aware what's going on. And then all of a sudden, after a month of not talking about, they'll ask a question, like there's something that they've been thinking about. And so, but anyway, yeah.
Is your dog okay?
She's fine. She
Okay.
just barks at
She
anybody
sounded
that
like
comes.
she was, she wants to be part of the interview.
She does. She does. She wants to be part of the whole. She wants to be part of everything.
If she wants to jump up and be
She
part of the
was.
conversation, that's
Well,
okay.
she should be part. I gotta tell you, because I think she spent when Samantha was sick. She was with her every day. She didn't leave her side for like 2.5 years. I mean, Samantha would go upstairs, lie in bed. She'd lie with her. She'd come downstairs. She'd come with her. I mean, she was like trailing her about the house through the entire illness.
In fact,
What is your dog's name?
she's Darla is her name.
Aw.
And she's very sweet. She smelled my relapse too. So yeah, when I first started realizing that I was relapsing, her behavior toward me had changed, and I told my doctor. I think she thought I was, this is a crazy dog lady, but no, I could set, because we spent so much time together, I could clearly tell her change in behavior towards me. That she started smelling my mouth a lot, and was almost like had gone from being with me to then she was guarding me, So, I mean, when you spend all day, every day with an animal, they don't have to be using words for you to pick up on the subtleties of their behavior and how they're treating you. And so, yeah, it's pretty crazy.
There's a lot of studies about that now.
Yeah.
Using dogs to
Yeah.
sense that.
Yeah.
So how's Murray doing now?
Murray's great. I mean, he's a special kid. I mean, obviously, I think parents think that about their kids all the time. But he's really sensitive. He's really insightful, and he's also been been part of the whole, the survivorship, cancer, onco-PCP, onco-generalist discussion. Like he's been hearing us talking about it for years now, and so he knows exactly what survivorship is. He knows what mom is doing. He recognizes the importance of her work, and he's totally out with it.
Yeah, I mean, they all are. And I think that's where Lily's cancer came from, because they all witnessed, getting diagnosed, me feeling rocked by this experience. And then especially the relapse, kind of letting go of all my former ideas about myself, what my career would be, my identity, and then like reinventing all that, and then deciding, hey, I think I want to do survivorship. But the time from having that realization of I want to do survivorship and what does that mean, and what do I think survivorship is, and then how I'm trying to deliver it now, and like grow a program within Kaiser that hopefully will scale up and become like a large scale thing. That process took, years, a couple years, a lot of emails, a lot of ups and downs, as I was kind of navigating the business case and how do you get buy-in organizationally from people, about the work, and growing a pilot and things like that. And so, yeah, they saw, and I even had to move kind of service areas within my organization to get the pilot going. So they saw all of that. And I think that again was like teaching them about resilience without having to say, this is resilience that we're practicing, They learned about overcoming hard things, and being really persistent, and not giving up, even when the answer is no, 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 that eventually down the road it might become a yes. So, yeah.
Wow. I wonder if they're going to practice that with you as teenagers.
Probably.
Very persistent.
Oh man. Well, I always say, especially for Lily, she is so fierce. Like, it is, wow. I mean, ever since she's been really little, and I just know that my job as a parent is to keep the guardrails up and like prevent bodily harm. And she just kind of knows what she wants, and my job is to keep her safe and like guide her in the right direction. But she's just already, from teeny tiny thing,
Wow.
just this big person.
So tell us about this program, Sam, if you can, that you're, if it's top secret, I get it, but that you're growing,
Yeah.
that you're growing at Kaiser. It sounds amazing.
Yeah, no, it's not top secret. In fact, I love engaging. I still do a ton of blood cancer support groups, just cancer support in general, advocacy organization things and outreach because I think that that really informs the model that we're building. Like I think that I have to do those things. I consider that almost like market research, you know?
I get
Um,
that. Trust me,
yeah,
I get that.
totally. Every conversation that I have, whether it's with the patient, their care partner, other providers, about how they're running their clinics in other parts of the country or the world, it's like I have this notebook that's this ongoing list of things that we're trying to incorporate, and it's just always going to be dynamic because the field of oncology is growing at warp speed, and so
It
yeah,
is.
so the program, it's interesting how it started. I I was a hospitalist initially after residency, that's a hospital-based physician, and then I became a primary care doctor, and then I got cancer, and I was diagnosed with relapse refractory Hodgkin lymphoma. So I took 6 months of the treatment, which has a pretty high cure rate. But I relapsed within a month of finishing 6 months of multi-drug chemotherapy. And even before I relapsed, one of the first conversations, and I didn't hear anything about the word survivorship there, but one of the first conversations at my first follow-up visit where my scan was clean, no evidence of disease, and I finished that first 6 months of chemo, my doctor, who was like very well-meaning and sweet, was like, "Congratulations, are you guys going to Hawaii?" And I just kind of looked at her like, "Oh my God, read the room. I am miserable." You know, like I am a shadow of my former self. I can't think. I've gained 40 pounds on steroids. My sugar's high. I'm, I don't, I don't even know if I'll ever get back to medicine, let alone going to Hawaii. Like, and I'm not even sure I want to be alive this way. Like, these were the thoughts going through my head. Um, and at that time, there wasn't any kind of mention of the word survivorship or what that could mean. And my first foray through cancer, I did kind of a very conventional path. I took all the treatments that were recommended to me, but I didn't really add in a lot of complementary therapies. I didn't know a lot about that or integrative oncology. I just sort of thought, okay, I got to check all these boxes, check, check, check. It's going to be a speed bump, and then we'll get through it. And then I'll just like hit unpause and move forward with my life. And then I got diagnosed with the relapse about a month later. And boy, did that it was just a surprise, a shock. And that's when I began seeing my cancer like as a teacher and thinking, oh gosh, I think this is trying to show me something. And suddenly the cure rates, remission rates, survival rates are much different than the first diagnosis. And then I kind of realized, oh my gosh, tomorrow is not promised, and I really felt that viscerally. And I think that I'm going to not just only do what my Western allopathic conventional medicine doctors talk to me about. I'm also going to start trying to understand, is this about something deeper in my life? And for me, I believe that it was. I think that stress was a really huge part of my illness experience and my illness story. I mean, yes, I was a marathon runner and I was like a vegetarian and considered myself pretty healthy before I got sick, but I was also a stress case. And a workaholic, and I didn't sleep that much. And I kind of equated being very successful with being okay emotionally. And after all the things that we had gone through with Sam's illness, um, I wasn't okay. I had a lot of, and even before his stuff, I had a lot of earlier life trauma. I lost a parent in childhood. And so there was all this kind of unprocessed grief and trauma. And I began thinking like, maybe that's all part of this, like maybe that was my underlying belief, that there's something about that's all intertwined with this, and that in addition to my chemo and my transplant and all that, maybe I better start looking into those things and find a way to release from fear and process some of these things and all that. And I also just started feeling the cumulative effects of being on chemotherapy for, years. Neuropathy, just chemo-related cognitive impairment, the most severe form of chemo brain. And so I started learning about that there's this thing out there called survivorship. I don't remember the first time somebody mentioned it, but when I started learning kind of what it was and how it was delivered in all these different places, that some people kind of thought it meant supportive care, some people kind of thought that it meant surveillance, and they used those things interchangeably. Some people thought it meant screening for late effects and second cancers later on. And then I started understanding, I think it's all those things, you know. And so I started seeking out survivorship care on my own, in terms of integrative modalities like massage and cupping and acupuncture and juicing and fasting, and then learning, like, oh wow, there's actually evidence for some of these things. I remember when I first learned about strategic fasting in appropriately selected individuals. So for me, I didn't have cachexia or cancer wasting, so it was like safe for me to do. But strategic fasting around the days of chemotherapy, like going on a water or juice only fast the day before, the day of, and the day after, that it substantially can reduce nausea and improve energy, and reduce the use of the need for anti-nausea drugs. And I was like, oh my gosh, I wish I had heard about this. And it makes perfect sense, because you decimate the gut microbiome with chemo, and then you give all these anti-nausea drugs that stop the motility. Like, of course, it's asking a lot of your gut if you eat steak and ice cream, and I had received all this different advice about
just eat whatever you want.
Yeah.
Because that's the kind of the going rate. I think when people are chronically ill, and I had my own, and we had also had that advice. Here, come closer. I'd also have that advice too, because one of my chronic illness was inflammatory bowel disease, which is a chronic condition of your gut, basically. And when you're sick, you can't eat anything because you just don't anyway. It just makes you feel terrible anytime you eat. But they're like, well, when you're feeling healthy, just eat whatever you want. And we had already been through that before. And with her, it was like, there was just basically, oh, well, if you have cancer and you're nausea and vomiting most of the time, then, well, I guess when you feel like eating, then you can just go to McDonald's and have a Big Mac. And that's just like crazy advice, right?
Yeah.
But I think we had a lot of time. We took a lot of walk because she usually now she jogs all the time, and I can't keep up with her. And also, I don't like jogging because don't like running. But we took a lot of walks, and a lot of the walks we would talk about this. And one of the things we realized, from a big picture standpoint, is that kind of the cancer treatment has made unbelievable, miraculous, life-altering, life-saving advances in the past really 20 years, 30 years, but a lot in the past 20 with the biologic agents and the genetically targeted stuff. And so we have millions of people that would not be alive 30 years ago with the same diagnosis that they're getting today. And so we've kind of figured out the initial part, which is, okay, how do we keep people alive, right? Okay, we've made unbelievable steps on that. And that's obviously hugely important. That's the primary thing, right? But what do you do with all the people that are still alive and now have their overall health is totally altered from where they were before? What do you do with those people? And so we were like, this is a whole area of medicine that has not been properly addressed, that we determined basically really needs its own, board certified subspecialty, because there's so much work for here. And oncologists are totally overwhelmed. As a doctor, you realize that like the pace of medical advancement is going faster than anybody can keep up with. That's why you have so much subspecialization, because there's, what used to be, one subject for one person to know is now 5 different, subspecialties. How do the oncologists keep up with that and all the new treatments, and with the increased patient load, because more people are having cancer and all people are more and more living with cancer? So these oncologists are totally overworked, and they're not able to address all of the other stuff, basically like the person's kind of overall health, spiritual, physical, diet, nutrition, mental health. Like there's a huge gap in care. And something needs to be done about that. And I think the answer to that is basically what Samantha is doing at Kaiser San Francisco.
So even just like the the food as medicine kind of conversation, movement as medicine. I started learning about all these things and even how to have those conversations. Like, I want to be clear, it's how we discuss those things. It's not that anybody caused their cancer because they didn't eat those foods. I don't want anybody to internalize that a Big Mac caused their cancer or anything like that. And when you're feeling really poorly, I mean, there's some connections with food and causing cancer, but food can be a tool to reduce the toxicity of the treatment. Eating a certain way to heal, to flood your body with nutrition can help restore your vitality, kind of going through treatment. And so that's a very how do you begin to have some of those conversations with people and explore what they might want to do in a way that they're not feeling judged, that they got cancer because they drank Diet Coke, and you can show them, like, here are all the choices that you can have in order to make yourself feel better during cancer or afterward. So we had these conversations and we started imagining, like, wouldn't it be amazing if there was survivorship, if there was like a doctor that started with you from the time of diagnosis? Because NCI, or the National Cancer Institute, defines survivorship as anybody living after a cancer diagnosis through the balance of life. But we kept talking about, okay, so if that's what it is, then why isn't it practiced that way? Why isn't, in most places, why is it not delivered that way? And I started talking to different people, like in Kaiser, where I practice, and there's some really amazing clinicians who do survivorship medicine, but it tends to focus on just a few diagnoses, and it focuses on after active treatment. Like, oh, once you're in the clear, then we'll start having these conversations with you about how you can help yourself feel better, about your vitality, about how you reduce your risk of dying from heart disease later on. And I thought, that just seemed crazy to me for a couple different reasons. One is, I think that there's so many tools in survivorship. What we think survivorship is: supportive care in cancer, rehabbing from really hard treatments, and then monitoring for second cancers and late effects of treatment, and body image and intimacy and sexuality, all these different things that why are we waiting to have those conversations until after the active end of treatment? And it's so overwhelming. Even the people who manage to get survivorship care going to a once or twice a year visit, there is so much housed within the field of survivorship. It's like drinking from a fire hose. And
Right.
so it made a lot more sense to me. Like, why don't we start delivering these concepts in the very beginning? Somebody gets diagnosed, and then we say, look, here's the word survivorship. At the very least, from today's visit, you need to know the word survivorship, because the word encodes this thing that will eventually become a new field in medicine, and it a new field in medicine that houses all these things to improve your quality of life and to help you heal from your treatments. And then the other thought that I had, in addition to like delivering it more toward the time of diagnosis with repetition built in the model, was, what about metavivors, which are people living with active metastatic cancer? The whole field of metastatic survivorship has changed drastically in the last 5-10 years with targeted
Yes, it has.
therapy
Yep.
and the oral EGFR drugs. There are people alive and working and in society with metastatic lung cancer and brain metastases, and they don't want to be treated like they've got one foot in the grave.
Right.
I think,
You know?
and that was also one of the big picture. I think when I harken back to when my mom was treated with breast cancer in 1989, and also in a lot of places now, it's like you get cancer, you hit the pause button on your life, and then all you're supposed to do is basically suffer through your treatment and get to the other end, and then you can resume living. But Samantha's like, well, why do you
Right.
have to wait until you have a clear scan, until a doctor says that you're cancer free, to live your life? Like we used to say, basically the job of the survivorship doctor is to make cancer suck less, right?
Yeah.
So it's like, it really sucks, but can we make it suck less? So
Yes.
if and also like you said, there's people who, because of the advancements, now cancer is kind of like a chronic illness, but
Right.
it doesn't mean that they don't have side effects that they need help with. So
Right.
they're never going to get to the clear scan, and they're never
Right.
going to be told that they're cancer free.
Exactly.
What about those hundreds of thousands of people who need help and and don't want to hit the pause button? They want to continue to work. They don't want to just go home from work, because maybe work is a source of, spiritual renewal for them. They love their job. Like I love my job. I love going to work, and Samantha loves her work and you love your work, right? Why do we do that?
Right.
What about if somebody is a runner, right? How do we help them with their neuropathy while they're in treatment so they can still maybe have a modified, but still continue with the exercise that helps with their mental, physical, and spiritual health? How do we help people while they're being treated with cancer? Because it's no longer, I'm going to have to, just grin and bear it, and it's going to be the worst 2 years of your life, but hopefully you get on the other end. Like that's 2 years. And a lot of people, maybe they aren't promised those 2 years. So
I think if you look at this, from my experience, look at this from the lens of the oncologist's office too, and they're working with, and the patient is working with someone, the survivor's working with someone like Sam, their symptoms are going to be more well managed. Their health is going to be better. They're going to tolerate their treatment better. Some of the burden is taken off of the oncologist and the advanced practice provider's shoulders as far as managing a lot of the I want to say barriers to treatment, the things going off the rails, because it doesn't happen as much when someone's health is more well maintained during treatment. Or if it goes off the rails, it hopefully doesn't go off the rails as much. Or Sam, because of her conversations with the patients, might actually catch things a little sooner.
Yeah.
Anyway, so I think that actually you would see better results, and people would probably have, just like when you see palliative care involved in treatment, you have better outcomes.
Yeah.
But I think
And
you
it's,
see it's in a bigger scale, to be honest.
right. I
yeah.
mean, better outcomes. I mean, a lot of the things. Of course, a lot of the stuff in medicine you have to make. Unfortunately, you have to make a business case for it. But
Right.
Samantha's always thinking of ways. Well, how do we, can we reduce ER visits? That's one of the easiest things to measure. Is basically if you have somebody that enrolls from time of diagnosis over the course of their treatment, do they visit the ER less? Which is obviously better for places like like a Kaiser system where all the finances are included. So they're if they can save money that way, but also of course from our perspective as a doctor, you don't have to go to the ER, which is anybody that's had to go to the ER, it sucks, right?
Mm-hmm.
Nobody wants to go to the ER.
It's awful. Yeah.
Even when you have to, it's the worst place to be as a patient.
And especially when you have cancer, like you
Yeah,
don't want to be exposed,
to everybody
to
that's already
everybody's
crazy.
coughing.
Yeah, exactly. You go in there and you're like, oh my god, like this person looks really sick and they're hacking up, and it's tough. But I mean, there's so much more to do in all areas of medicine. But I think that the survivorship project is going to be successful because it just is good medicine.
Mm-hmm.
It's necessary, right? But also, I have to say, bias is that people like Samantha, like it's going to work because Samantha's doing it.
Mm-hmm.
Well, I mean, I've like I said, I've been a patient since I was 20 years old. I'm 44 now. I've been a doctor, since we finished medical school in 2012. But her experience is unique, and her skills as a doctor are also unique. So you put that together, and her program is going to be successful. And then
Oh, I have
hopefully,
no doubt.
yeah,
Because you're a very intuitive person too, Sam. In addition to being very smart, I can just tell by talking with you and what you're saying, you're intuitive. You listen extremely well. And that's a big part of what you do, is being a really good listener. I cannot wait to see what happens with your program. And I think it's going to end up being forging a path for other programs to follow, to be honest. And I can't wait to see what happens. I really can't.
Yeah, I mean, I just think there's so much work to be done in survivorship, and that there's enough room for all of us and all of our ideas. And I don't think like I'm better than anyone. Like there's so much work that's been done already that's informing what I'm doing. And I really look to a lot of the experts, people who've been doing this a long time, to kind of help me. Like there's this organization called the Cancer Survivorship Provider Network, which is really amazing, and I've been involved with them, and I just put a call out to them like, hey guys, I need help. I need like a committee that can help me prove the return on investment, because one, I'm not a researcher. I don't have a research background, but I think it's important that I work with researchers so that I can demonstrate how effective this is. Like, this can't just be all rooted in passion. Like, unfortunately, for better or worse, like medicine is a business. And even though I'm 100% passion and like altruistic intentions, I need people to help me prove what I know in my core of my being, that this is good medicine, that it's going to improve outcomes. But I need people to help me prove that. And so, like, I've got friends in the survivorship space now from all the networking that I did as I was getting into this and healing from my own treatment, um, that are helping to kind of figure out, well, what does that look like? What are some of the things that we could measure? And I just love that, because this is a team sport.
Right.
And even with oncology, like, I think it's just part of the role of the onco-generalist, or somebody who's doing survivorship from the time of diagnosis, is to break down the silos and to have really good communication with oncology. I talk to oncology all the time, and I say, this is what I'm thinking. Do they need this test? And they'll say, no, 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 they don't need that test. Or thanks for letting us know. We didn't know that they felt that way.
And also, you could talk about how the patient that had the three different providers, and they were all on different pages, basically. Remember?
Oh yeah, I mean, yeah. I don't. Well, yeah, I had yeah, a case where there were just a lot of different subspecialists involved, and and they were all saying different things to the patient. And so I can be somebody who really quarterbacks for people, and says to the provider, like, hey, you said this, you said this, you said this. This is what the patient heard. This is what I'm hearing. Help me help them.
Right. Our people who are going through cancer they have a medical oncologist for their chemo. They have a radiation oncologist for the radiation. Then they have a surgical oncologist that's going to be part of like a surgery side. And these three people don't talk to each other necessarily. Like maybe they read their notes in the medical record, but you could have an appointment Monday and then Tuesday to Wednesday, and before their documentation in the chart, they're hearing three different things. And without somebody like Samantha in your survivorship work, that person's like, I don't really know where I stand. I don't know what questions to ask. I don't know what I'm doing next week. So it's really important to have somebody that can bring it all together.
That is very helpful, really. One of the things that we were talking about before we started recording that I think is really important, and I know you were talking about in Washington, D.C. with CPAT, is self-advocacy. And where you found yourselves, the hard lessons you learned, and what you think are really effective ways to advocate for yourself.
I've been talking too much.
Well, I think like one of the things we talk about is and I dealt with this as a patient, right? I've basically been a patient longer than I've been a doctor, so I always kind of a little bit veer more towards the patient side. Is that this need that patients have for the doctors to like them? It is really, I think it's understandable that you want your doctor to like you. I think people unfortunately feel that, if my doctor doesn't like me, I'm not going to get the same treatment as I would if the doctor liked me. That somehow the care is going to be different if their doctor likes you. And so that I think it inhibits people at times to advocate for themselves, to ask hard questions of the doctor, to maybe push back if they don't understand. We're not where we were back in the early days of medicine, where you just did whatever the doctor said and you don't ask because the doctor knows better. I think people definitely, with the internet, people are definitely a little bit more, but still, I think it's when the more serious the medical problem, it almost feels like the less people push their doctors. Like, when it's less serious, they feel more room. But like when your life is on the line, I think people feel really scared to question or to just to really get into a dialogue with their doctor, because that's what it should be. Because there's very rarely one treatment that fits everybody. And so patients need to get over this thing about worrying that their doctor likes them and whether it's going to affect their treatment. And that's stopping them from advocating for themselves. Like some people won't talk about side effects. Like we have people that we've talked about people that, like for instance, like Samantha told me, I didn't even know about this. Like basically like a lot of people after breast cancer are on the endocrine
the endocrine therapy.
They have endocrine therapy, and the endocrine therapy makes them feel so terrible that they don't even take it because it makes them feel so miserable, and they're basically afraid of their doctor that if they don't do what their doctor has recommended and say, look, I'm not taking this endocrine therapy because basically what's the point of living if I feel this terrible? Why would I want to take this medicine that makes me not want to live? And so they don't tell their doctor, so that can lead to worse outcomes. But you can
Right.
speak more to that on that particular front.
Yeah, so if they feel that they can't advocate for themselves, and like how I show up as a provider makes it okay to say, I'm totally miserable on this endocrine therapy, like I need help, it hurts so much, then I'm like, yeah, of course, a lot of people struggle with that. Let's prescribe you a course of acupuncture. What about movement as medicine and qigong, or all these different things that might not occur to people to try, and then they feel better in their body and they're able to tolerate their endocrine therapy or their adjuvant treatment, because I didn't just respond like, no, you just have to take it.
Right.
That's just what you have to
And we
do,
know people that have basically, also people need to feel comfortable with bringing up, like, that's why it's so important that Samantha also is doing this integrated medicine fellowship, right? Because people are obviously out there, they're on the internet, they're Googling things, they're like, I want to do everything possible to stay alive for myself, for my children, for my family. So what about this herbal supplement that I'm reading about? What about this thing I saw on YouTube? And, there may be think that if they go to the doctor with one to take, kind of a out of the Western medicine box, the doctor's going to look at them like they're a crazy person, right? So we
And they're
really
not.
want to make a safe space
Yeah.
for people to understandably do everything they can, but we don't want people to run away from the Western medicine, which we know is also effective, right? Because we have people that basically stopped doing their Western medicine and just kind of went off on the kind of alternative treatment. But people need to be able to do both. We want you to say, look, this is what we recommend from the chemo. But if you want to go off and do acupuncture, you want to try some herbal options, like do that too. But we want people to feel safe to do both.
And
Right.
I feel as a survivorship clinician, I need to know, okay, well, what supplements are like, liver enzyme inducers or inhibitors and will interact and either make your therapy more toxic or less effective. And how do you source a good vitamin? Maybe there's parts of your treatment where you shouldn't be on any vitamins or supplements
Right.
at all based on what we're prescribing, and just how to have more of those nuanced conversations so that patients know, like, oh, okay, like she's okay with complementary therapies just at certain parts, and she just wants me to be safe. And she'll let me know like when it's okay to try those things. And the answer is not just like, no, that's quackery, don't try any of that, like only do what I say, because I've encountered people who have had that response from their
Mm-hmm.
clinicians, at different parts of my career, with like catastrophic consequences where they did feel judged, that and they didn't feel like they could disclose some of the things that they were trying, and sort of paused the things that we know work, because they wanted to try other things first. And it was about the sequencing of things and not being able to safely combine like all the appropriate choices at one time, and deciding on their own without the medical team, like I'm going to try this first before that, and then losing ground with the cancer. So yeah.
That's amazing. I actually interviewed a clinical oncology pharmacist who has very in-depth conversations with patients about that. And he said one of the things that's really important to him is to give the patients he works with control. He does not want to take that away from them, but he wants them to understand exactly what you were saying, when it's safe to take something and when it's not. They need to there may be times they need to time it with their treatment, or
Mm-hmm.
times they need to avoid taking it altogether because of toxicity or interference issues.
Yeah.
And he's actually working with an advanced practice provider in his particular healthcare system to start a survivorship clinic that starts with diagnosis because of his specialty. So I would say suggest to Kaiser Permanente to see if you can have a clinical oncology pharmacist on board 4 or 8 hours a week that you can go to run these things by, because that is their wheelhouse, like
And she
down
is
to the molecular level. And it
Yeah.
sounds
I mean,
like you understand it very well.
this is what I mean. I won't speak for her, but I mean, we've talked about this stuff, so I don't know nearly as
Yeah.
much as her, but I know that what she needs, right? What we all need. I mean, what I need my pediatric practice is, multi-modality, basically specialists, right?
Right.
So survivorship programs need to have, you know, basically advanced practice providers and MDs and DOs, right? They need to have a social worker. They potentially could have a nutritionist, and they definitely need to have a clinical, a clinical oncologic pharmacist, I think is the term, right?
Yes.
I mean, you need to have all these things.
Yeah.
And
Would be
so
amazing.
right,
That
for a
would be
survivorship program
wraparound.
to really be optimal, you need to have everybody together because the healthcare provider, the APP or the MD, is not going to be able to do everything on their own.
No,
And not
it's
to
too
mention these
much.
people,
Right.
the clinical pharmacists, they know so much more about the medicine.
Yes.
I mean, they're wealths of knowledge. I mean, they just know so much of that. And to not take advantage of that would just be terrible.
Mm-hmm.
But
So,
your wealth of knowledge, Sam, is obviously amazing. I'm so impressed, and that you work with your patients down
yeah.
to the nitty gritty. You give them a lot of control, and that's so important. Our audience is that I'm sure they're sitting there nodding their heads, saying yes, yes. That sense of control, and you get that because you've been through this. There are so many things you can't control. So anything you can is so near and dear to you, and you want to hold on to it. And integrative medicine is so important, but isn't that the definition of integrative oncology? Is you integrate
Yes.
the supportive care, the complementary medicine with the Western medicine. And so you practice integrative medicine and integrative oncology. And
Right. It's
right,
I always say like I'm not telling people to like meditate their cancer away. I
right.
go over the labs and the scans, and I help them follow the treatment plan of the oncologist, and I talk about all this other stuff, and I ask them one of the most important questions I think I ask, because I wish it would have been asked of me, is do you have any underlying beliefs about your cancer? Just
Mm,
very open ended. And some people say, yeah, I think it's my childhood trauma, or I think it's my toxic marriage, or I've had a really horrible workplace situation for years, and I felt like there was never an out. And people tell me all kinds of things. And I try to honor that in their story and in their cancer experience. Like I don't try to like argue people out of their beliefs. I'm like, yeah, if that is your deeply held belief, that needs to be at the center of this experience. And like, let's do everything we can to help you address that, to release it, whatever we can. And that's part of the medical plan. And it's
yeah.
it's important, along with your infusions and your radiation and all that.
And we need to also, I mean, look, doctors work hard, and
Yes.
oncologists have huge patient loads, right? Because of where cancer is staying, the numbers. So patients need to not only think about advocating for themselves, but they're also think about it as helping your doctor, right? So one of the things that we kind of talk about is good idea is like bring in a picture of what of who of basically maybe if the doctor's never seen you before you're bring a picture of what you look like when you have your hair, when you look healthy, right? Tell bring in a picture of doing something that you love. Maybe you're a violin player, right? Help the doctor understand who you are when you are at your best. Like, this is what I love to do. This is what's important in my life. Is there a way that we can somehow, during when I have my cancer, can we somehow protect these things, right? Like if I am a violin player and I'm gonna get chemotherapy that's gonna give me, bad neuropathy, can we really focus on that particular side effect? I want to do everything I can so that I can continue to play violin through my therapy because it helps me to maintain my spiritual wellness, right? So bring in pictures of yourself, introduce your doctor. Like, oh, and by the way, I used to be a gymnast, or I used to be a competitive swimmer. Or these are the things that help me maintain my mental, physical, and spiritual health. Like, help your doctor so that they know how to help you better.
And that can translate to like practical things. I mean, if neuropathy is a really huge big ticket item for you, I mean, there are these gloves that people can wear that cause constriction in the vessels during chemotherapy, almost like cold caps on the head that reduce neuropathy. And not every place covers it, but patients can get them themselves. And it's like, you don't know what you don't know until you have these conversations.
I think open communication with your oncologist is so important. And Sam knows this from going through the book I sent her. Keeping track of your symptoms and not waiting till your next appointment, but notifying your oncologist, notifying the Sams of the world, if you are fortunate enough to have one, of what is happening and what your symptoms are, and on a more prompt basis. And then also writing your questions down ahead of time, like you were saying, Sam, so that you can walk into your appointment prepared with your symptoms already documented and they're like real data. You're not recalling them off the top of your head. And then also your questions written down ahead of time, because that helps that conversation go. And you are helping your oncologist then get through their visit with you and understand what you need. On top of that, what you were just saying, identifying what is important to you. And what is important to you can be very fluid, just like how you feel during your treatment is fluid, or your priorities may change as you shift from one part of your treatment to another, or your outlook shifts, your priorities are going to shift. And so if you sit back and just think about what is important to me right now over the next 3 months, over the next 6 months, over the next year, and writing those down can help you have that conversation with your oncologist and with your onco-generalist or the generalist or the person that you're working with in your survivorship, and they'll help you get there. They will help you identify how to get there. And it may also mean advocating for yourself to be strong in stating that. And I like how you said you don't worry about whether or not your oncologist likes you. It's more, this is how I explain it to people, is this is your life. This is how you feel. This is your future. That's a lot at stake. So keep that in mind when you're in that room. This is the oncologist's day. They're very passionate about what they do. They have to be in order to spend the kind of time they do. But it's their job. And so there's a different set of stakes there, if that makes sense. Also, having another person with you can make a big difference. A, they can add moral support. B, if you can't quite get to asking your questions because your heart is pounding out of your chest, they can ask it for you if they know what your questions
And
are.
on that note, one of the things we talked about, like we did a whole we go into a whole topic basically, the role of first of all, role of the primary support person. We talked about how to support the support person, but also the role. And one of the roles is the support person doesn't have the burden of wanting to be liked by their doctor. So if the
Right.
person is like worried that if I push on this particular issue, the doctor is not going to like me because I'm questioning their medical decision making, let your support person be the bad guy. It's okay. The support person doesn't need to be liked, right? So they can ask a question that maybe the patient themselves is a little bit, timid or afraid to ask. Have that difficult question come from the support person.
And always ask for a second opinion. If you are questioning things, there is no harm in getting a second opinion at
Yeah,
all.
we hit on that. That was one of like our like main topics was
Right.
always ask for a second opinion, and also ask from the front. Your treatment does not have to be failing to get a second opinion.
Right.
So you should have. It's like when you get your roof redone, you get multiple bids. So you're not going to get multiple opinions on something that your life depends. You're just going to go with the first guy and say, "Oh, I guess this sounds good." Get a second opinion at the very outset. If you're oncologist, which I think most of them are, if they're not okay or if they seem threatened by a second opinion, then maybe that's a red flag that you need to find a
Yes.
provider if it's available. Because
Right.
all good doctors, your ego should be small enough to know it's not about you, that your patient needs to feel confident in whatever treatment they're going with. You should be encouraging a second opinion. And I think most
Exactly.
oncologists are on that page. They're like,
Yes.
of course, we encourage second opinions. Please go to this person. That should be almost lesson number one. Get a
Yes.
second opinion from the outset.
And if there's progression, or if you're not feeling right, or things are
Right.
not happening the way you want them to, or your symptoms are not being managed and it's really interfering with what's important to you, you can go get a second opinion, or you can talk to someone else. You can talk with your navigator. You can talk with Sam. You can talk with your PCP. This is what's happening, and I want to talk with someone else because I can't go on this way. And my oncologist isn't hearing me, or I'm whatever. But if your oncologist isn't listening, find someone else who will help you find someone else to talk with about it. That's incredibly important, because symptoms can be managed in different ways. Palliative care can help you. They think outside the box. And now we have integrative medicine specialists, who often cross with palliative care and thinking outside the box, but they really go into a lot of complementary medicine too. So there's a lot more resources out there, and gather your people around you to help you find them. Maybe if there isn't a survivorship clinic around you, find an integrative medicine PCP or a functional medicine PCP who also understands oncology and will help support you through that.
Yeah, I didn't come by all this knowledge easily by being a doctor, and then as a patient. Like, this was all really painful lessons, I think. And I didn't join groups in the beginning. I just thought, oh, like joining groups and nonprofit stuff, I don't know, it's going to make me sad and it's going to be like such a downer. I really kind of thought that and held a lot of those kind of preconceived notions. And then when I started joining, when I became a joiner, I was like, oh my gosh, this is not just amazing emotional support. Patients and care partners who've been at this a while, they know a lot of stuff, like a
They
lot of
do.
really good information about navigating care, about early introduction of clinical trials. You don't have to wait till you're on death's door or till you've failed multiple lines of therapy to look into a clinical trial for something. They know about, just living with cancer. And that was such an eye opener. And so now I encourage people like to become joiners as soon as possible, because I think it helps complement all these other parts of your care where maybe your oncologist can't do everything, but these are all really important pieces of the cancer experience, the everything cancer. These are all really important parts of it. And I think if all this has failed to address, I don't know, it's just really important. Like, I believe that healing and cure are not synonymous. And I
Right.
mean that their cancer can be cured. They can have no evidence of disease, but still be really in turmoil internally. And I also believe, conversely, that somebody could have really advanced metastatic cancer and can be healed. Like, I think that healing is possible in all stages of cancer, even up into the end of life. And that is some of this little more kind of nebulous supportive care type of stuff that's really important.
Yeah, I mean, yeah, exactly. I think that just to emphasize, I've never been a joiner myself of support groups, but I think I think but with Samantha's experience with support groups, I mean, patients know so much.
They
You
do.
can't, you just, even if you've been an oncologist for 30 years and you prescribe and you have that 30 experience, until you have one day as a patient, you can't, it's almost impossible to have that perspective. Even if you're the most well-meaning, most empathetic person, it's just different. And so these support groups, I mean, I think sometimes it's a little bit scary. I think one of the things that I was scared of was like being in a support group with people that have a similar diagnosis but are actually worse off. Seeing what the people that are worse off with cancer, that might be scary. But like, I don't want to be in this program because there might be somebody in there that's really, really sick, and that's scary. And I don't know how to get over that, but there's so much good information from patients, especially if you're just starting out. Somebody's been doing this for years. They can hopefully help you to avoid the same mistakes that they went through. And.
It's not just mistakes, it's how to
Right,
overcome barriers
right.
to
Not even
the
mistakes really,
great,
because you don't
right.
know you're making a mistake because you don't know. Right.
Right, right. I
But
mean, it
yeah,
is a great sharing of information, and the peer support is amazing. And to your point, Sam, the support group I facilitate, we had a woman who entered hospice, but she talked about her decision.
Right.
And she said, I'm going to golf as much as I can until I go.
Right.
And we all laughed about it with her. I mean, it was a tough conversation, but we ended up laughing at the end. And we talked about, and to this day, we talk about her and her golfing. But I think that conversation was very comforting to the other people in the group, because if they ever have to reach that decision, they have her as an example now of how to handle it. But she lived life to the end, like you're
yeah.
talking about. Living life is, I think that is so critical, to live life no matter where you are in your journey.
my friend, I would be remiss if I didn't mention my best friend from blood cancer support group who passed away, Tati, and she completely like um, reframed cancer for me and vitality in cancer. And she said things like, I just want to be fully alive until I'm not. And she said those things in our support group. And she also would say things like, they're treating me like I'm already gone, but I'm still here, you know? And she was the most alive human that I've ever met. And she was only in remission like 5 days of the year that I knew her. Um, and she showed me what is possible, like how much vitality is left on the table for people with cancer, and people need help accessing that vitality, like making those choices about golfing, about hospice, about even in California, one of the things that has come up recently with some of my patients is end of life option. There's people that have progressed on multiple lines of therapy, and another choice that they want to discuss is the End of Life Option Act, um, and that they want to just like have a party and see everybody that they love and say goodbye and then take the medicine. I mean, there's all these and that's a choice too, and even though it's a very difficult thing to talk about, people want the whole menu of options, regardless of where they're at. And I think that I just love the movement of advocacy and choices that's happening in cancer, because I think you think back to the 50s and the 60s, and just cancer was such it was a bad word, it was taboo, it was, shameful. It was very sad and kind of kept in the shadows. And now I think there are people living fierce lives with cancer. But you still see the concern about like the stigma of cancer, especially with some celebrities, like who suddenly pass away and you're like, oh my God, they had cancer? We didn't even know they had cancer. And I think part of it is because they don't want that to be their whole identity, even though it is a huge part of their life, they don't want that to be their whole identity. And so it's really interesting, I think, the conversations that are happening in cancer in society. And yeah, we need a whole new field of medicine to address it, because it's just changing so much.
And you are pioneering it along with many other people.
Yeah.
You're blazing trails along with many other people. Is there something that we haven't covered? Because I'm sure we'll be talking again in 6 months or 8 months to check back and see how things are going. But is there something we haven't covered here yet that you would really like to talk about? And I think another interview sometime would be body image. I think that would be a great interview for another time.
That's
Yeah.
what I was thinking. Oh my gosh, we didn't even talk about like
We
sex,
can
intimacy, work in cancer, because even
romance.
romance, I mean, yeah, we have had to reinvent our intimacy just many times throughout
Yeah.
this. And as with body parts changing and losing hair and, ostomy and just a lot of stuff. And there were some rough patches. Um, and that was difficult. And then also even like I think the work conversation was really
Mhm.
an eye opener for me. There were times when I could not work. I didn't feel well enough. My cognition was not where I felt like I wouldn't want a doctor like me right now, And so rehabbing from the treatment, and then having more nuanced conversations about like, well, what type of work do you do, and like, is your work able to accommodate you? There are different options for modified work, and we're not very good at those conversations in medicine. And so I think those are just another set of choices. But yeah, those are some of the things I think we'd love to, that it really impacted our lives, especially in the AYA cancer space. So adolescent and young adult, I think that goes all the way up till maybe 45, depending
Mhm.
on how it's defined. But, shepherding a young family, work in cancer, intimacy and body image, like those are some really hot ticket items for us.
Right. I
Well,
think that
let's go ahead. What were you going to
the
say,
last thing
Sam?
I would say is I think that um, you don't necessarily have to reinvent the wheel, because I think as a pediatrician, if you look to how childhood cancers are managed, you can learn a lot about what we need to do with adults. because they basically been, I in my where I trained where I trained in my residency for pediatrics, it was like basically the referral center for all of Northern California for pediatric cancers. So we had cancer. When we were in the hospital, we had a whole team we had 10, 15 cancer, kids with cancer. And when you see all the support, I mean, as soon as you're diagnosed with childhood cancer, you're meeting with a social worker, you meet with the clinical pharmacist, you meet with the child life specialist, and they are basically doing survivorship already in pediatric cancers. And if we could pull basically some of that or all of that into the adult world, a lot of these shortcomings would already be addressed, because you know it's and then I'll go back to my other point. You don't have to hit the pause button on your life. It's not like you said, like these celebrities, like, right, you get cancer and you just like disappear off the face of the earth, and why you're being treated. You don't have to just pause your life, and just all you have to do is be a cancer patient. Just bite your grit your teeth and get through it. We need a way to help people live while they have cancer, so the only focus should be just not on dying. It should also be on living with cancer, right? Because people will live 5, 10, 15 years with cancer, and that's fantastic.
It is fantastic, or even longer.
Or even longer. They'll live forever. They'll live 30 years. I mean, exactly. They'll live 30 years.
But not dying is not the same thing as fully living. And
Right.
we need a higher bar than not dying. That's kind of like my thought going through this is
Exactly.
We need to aim higher than just not dying, And I think one of the things I say repeatedly in multiple spheres in the cancer space is it's not greedy to want more than not dying. So for me, getting back to jogging, feeling good about my body, being able to have sex and enjoy it, like those were all things that were really important to me. Quality of life, having enough energy to run after my kids. Like I wanted more than not dying. And there were times when I don't think it was any one provider. It was just the process in general made me feel like that was asking for too much, that I should just be grateful that I'm one of the lucky ones who got a good cancer and got to stay alive. And I just don't think that that's the lived experience for a lot of people. Like and there's all these reasons why it's very difficult to bring up just quality of life issues. I think some of it's like they're difficult conversations. They can be embarrassing. I do a lot of work with National Coalition of Cancer Survivorship, NCCS, and they give this survey every year, State of Survivorship. And one of the things that they found out is that some patients don't bring these issues up, not because, and the main reason why is because they're not even sure anybody could do anything about it anyway, So there's this hesitancy to bring it up. Thank you to you and to all the survivors, thrivers, cancer crushers, whatever people want to call themselves. Like, thank you for all the conversations that you've had with me, all the comments, because I really think about the things that people tell me and the experiences that they share, and I try to include that in some way, shape, or form into what we're building, and it means a lot. So this is not all like my idea. I hope that what we're building is a reflection of all the things that I've seen and have taken in over the last few years from everybody that in the cancer community across diagnoses. So thank you.
Thank you for joining us on this episode of the Everything Cancer podcast. We hope you found the conversation as insightful and as inspiring as we did. Remember, all the details about our guest, including their contact information and links to resources they've shared on their websites, will be included in the show notes. If you've enjoyed this episode, please consider supporting us by visiting our website, checking out our Patreon page, or becoming a sponsor. Your support helps us to continue to bring you these important discussions. Don't forget to subscribe to the Everything Cancer podcast on your favorite platform and follow us on social media. Always remember, the information shared here is not intended as medical advice. For any personal health concerns, please consult with your healthcare team. Thank you so much for listening, and we look forward to having you back with us again next time. Thank you for joining us on this episode of the Everything Cancer podcast. We hope you found the conversation as insightful and as inspiring as we did. Remember, all the details about our guest, including their contact information and links to resources they've shared on their websites, will be included in the show notes. If you've enjoyed this episode, please consider supporting us by visiting our website, checking out our Patreon page, or becoming a sponsor. Your support helps us to continue to bring you these important discussions. Don't forget to subscribe to the Everything Cancer podcast on your favorite platform and follow us on social media. Always remember, the information shared here is not intended as medical advice. For any personal health concerns, please consult with your healthcare team. Thank you so much for listening, and we look forward to having you back with us again next time. And for anybody that you have invited to join us, please reach out if you would like to be a sponsor. We would welcome you. Thank you.